That's right. Despite many advancements in liver transplantation, like the cure for the hepatitis C virus, liver disease continues to impact people of all ages and cultures across the globe. Expert Richard Gilroy joins us from Intermountain Medical Center Transplant Services, and he shares the most recent findings on reducing mortality rates and the need for transplants in some patients. Thank you, doctor, for coming here and explaining. You guys just returned from the Czech Republic about these new findings and presented them.
We were at Prague at the International Liver Transplant Committee meeting, and Michael Charlton, my partner, and myself were involved with a study which is a pooling of multiple center studies that specifically looked at hepatitis C treatment. And the new data tells us that some people that we should be treating, we're not. But more importantly, if we treat these people, we can prevent them needing a transplant. And also, if we prevent them needing a transplant, we save 2 lives because someone else can get the organ they would have used.
That's huge. And there was also a study involving medication.
Specifically, the study there was a drug called sofosbuvir, and they looked at this medication and they applied it to all of the patients who've received it in clinical studies. And when we looked at it across the board, we're actually able to predict who we should give it to and how much benefit it will provide in terms of preventing them going to transplantation. So the bottom line is we've released very important data that is multi-center, multinational data that tells us that for Utah, there's an opportunity to treat more people and prevent them needing a transplant.
And these are some pictures from overseas. I want to add and point out how important this is that you guys specifically looked at hepatitis C, because we've talked about this, that the heroin epidemic has caused issues and can cause hepatitis C. Is that correct? Correct.
So we look at the hepatitis C issue, and there's 2 elements. Number one, it's acquired from IV drug use. Number 2, the heroin epidemic has led to a rise in hepatitis C in the community. Now, these donors at Intermountain we're using as donors if they die from an overdose to save the lives of individuals, and family members have discussed with people about their willingness to donate. And so we can say now that we are confidently the first center in the country and one of the first in the world to ever use hep-C positive donors for hep-C negative patients. Number 2, those people who've acquired the disease, so far we've treated 2 post and they're clear. And this has led to even England, or at least the UK, is now across the board offering hepatitis C positive donors now to hepatitis C negative recipients. So this is something that Utah did first.
This is incredible and remarkable, and thanks to you that we can save more lives now.
We can, and the most important thing, don't forget, talk to your family about donation.
Yeah, being a donor, it's so easy and so simple, and that's really the message you've always told us.
Thank you.
Thank you so much, Dr. Gilroy. More information at Intermountain Medical Center Liver Transplant Services and on our website at goodforutah.com.